You know that sudden, intense urge to find a bathroom, maybe even with a bit of discomfort.
Yeah, we've probably all been there at some point.
Definitely. So today on the deep dive, we're kind of unpacking what's behind those feelings. Technically, they're called dysuria, which is painful urination,
Hmm.
and pollakiuria. That's the really frustrating need to go like all the time, but only tiny amounts come out.
Right. And, it's easy to just brush these off as annoying, but it's actually pretty important to understand what our sources point out. They can be, and I'm quoting here, unequivocal evidence of lower urinary tract disease.
Whoa. Okay.
Now, hang on, we're not jumping to diagnoses here or anything like that. But what's really interesting is digging into the potential reasons why this stuff happens.
Exactly. Think of it as like getting a backstage pass to understand the signals your body might be sending. It's about being informed, definitely not about self-diagnosing.
For sure.
And while these signs often point towards the bladder and the urethra, it was kind of surprising to read they don't automatically rule out problems somewhere else,
Mhm.
higher up in the urinary system or even other body systems entirely.
And what's also fascinating is this isn't just a human thing. Our source material specifically mentions these are common signs in dogs and cats too.
Oh, interesting.
So as we get into the mechanics, it's kind of a good reminder that these are pretty fundamental biological processes that affect, well, lots of species.
Okay, so our mission for this deep dive then is to really get past just the definitions and dig into the why these uncomfortable, frequent urges happen based on our sources. So, where do we even start peeling back the layers on this?
Let's begin with the basic mechanics. Think about the bladder and urethra. They're essentially designed for holding and then releasing urine.
Right.
But if there's inflammation or, some other kind of issue down there, it can actually damage the structure itself, or it can irritate the network of very sensitive nerve endings in the area.
Okay, so if the structure is damaged or the nerves are just constantly firing off, what happens then?
Well, that damage or irritation, it leads to a situation where the bladder basically can't stretch and hold as much urine as it normally would.
Ah,
Think of it like maybe a balloon that's lost some of its elasticity, or it's become super sensitive, right?
yeah.
It just won't hold as much air, and even a tiny bit of pressure makes it react.
That's a really helpful way to picture it. So this less stretchy or more sensitive balloon creates those urgent feelings, maybe pain, and then that leads to all those frequent but kind of unsatisfying bathroom trips.
Precisely.
Now, our sources, they list a whole bunch of potential causes specifically related to the bladder itself. That list looked pretty long. Where do we even begin?
Yeah, it is quite a list. A really common one, probably the first thing most people think of, is a UTI, urinary tract infection.
Right, the classic.
And these can be caused by, well, a whole range of tiny things. Bacteria, obviously, but also viruses, fungi, parasites, even these little organisms called mycoplasma.
Wow.
But it's interesting, while UTIs are often top of mind, the sheer number of other things our sources list really shows how complex bladder issues can be. It's not always just a simple infection.
Right, so UTIs are kind of the usual suspects, but they're just the tip of the iceberg, huh?
Yeah.
What else can mess things up directly in the bladder?
Another one is something called urocystolithiasis. Big word,
Yeah.
but it just means bladder stones, basically little mineral formations that can develop right inside the bladder.
Oh, ouch.
Yeah, and you can imagine they can cause a fair bit of irritation.
I bet. And the sources also mention neoplasia. That's a term we usually link with more serious stuff.
That's right. Neoplasia basically means abnormal tissue growth, like tumors. The source specifically brings up transitional cell carcinoma as one type of cancer that can affect the bladder lining.
Okay, that's definitely important to know about. What about other kinds of like direct injuries or physical problems with the bladder?
Trauma is another one, unfortunately. Any kind of physical injury to that area, maybe from an accident or sometimes even a medical procedure, can lead to pain and urination changes.
Hmm.
And then there's this whole category of anatomic abnormalities. This covers a surprisingly broad range of structural issues, things someone might be born with or that develop later.
And that list was super specific, wasn't it? I remember seeing things like ureterostool,
Oh.
persistent uterus masculinus, even cases where the bladder gets displaced into a hernia,
Yeah,
spagranulomas.
exactly.
It really drives home how many different sort of physical quirks in our internal plumbing can actually cause these symptoms. It's not just one or two things.
No, it really highlights how finely tuned the whole system needs to be. Then there's detrusor adenine.
Detrusor, that's the bladder muscle.
Yeah, the main muscle in the bladder wall that squeezes the urine out. Adenine just means it loses its tone, its strength. so the bladder doesn't empty completely.
Okay.
And the sources mention things like chronic partial blockage or dysautonomia, which is a problem with the autonomic nervous system, as possible reasons for this muscle weakness.
So it's like the muscle gets a bit lazy, and even if there's only a little urine left, it can't quite push it all out, leading to that feeling of still needing to go.
That's a good way to think about it. If it's not emptying fully, that could definitely contribute to feeling like you need to go again soon, even if there isn't much there.
Makes sense. What else can kind of throw a wrench into the bladder's works?
Certain chemicals drugs can be culprits too. The sort specifically named cyclophosphamide, which is a drug used for some conditions.
Okay.
And then we get to iatrogenic causes.
Iatrogenic. That means caused by medical treatment itself, right?
Exactly. And this list is quite something. It includes things like urinary catheterization, sometimes even just, a doctor palpating or feeling the bladder during an exam. Yeah, certain flushing procedures, overfilling the bladder during x-rays, methods used to remove stones, cystoscopy looking inside with a scope, and even bladder surgery itself.
Wow. It's almost a bit sobering to think how many things, even things meant to help, could potentially cause these issues.
It really highlights the delicate balance, doesn't it?
It does. It's kind of wild how many things can impact something we usually don't even think about. And finally, for the bladder, the list mentions idiopathic causes. That's basically when doctors are stumped, right?
That's a fair way to put it. Idiopathic means the specific cause just isn't clear. The source gives idiopathic feline lower urinary tract disease as a prime example. It's a really common issue in cats where, despite lots of tests, they often can't pinpoint the exact trigger.
Huh. It's fascinating that even with modern medicine, there are still these kinds of medical mysteries.
Absolutely.
Okay, so that's a pretty massive list just for the bladder. But the source material also makes it clear that similar things can go wrong in the urethra, the tube leading out, right?
Yes, exactly. And just like the bladder, UTIs can definitely affect the urethra too, causing those same symptoms of pain and frequent urges.
And stones can happen there too. You called it erythrolithiasis.
Spot on. Erythrolithiasis, stones in the urethra. And unique to the urethra, you can also get urethral plugs.
Plugs, what are those made of?
The source describes them as a mix of matrix and matrix crystalline material. Basically, think of it like a blockage made of inflammatory material, mucus, and sometimes crystals. It can really block things up and cause a lot of discomfort.
Oh, sounds awful. And I assume the urethra isn't safe from neoplasia and trauma either.
Sadly, no. It can be affected by tumors directly, or, as the source notes, tumors from nearby tissues can actually grow into and affect the urethra. Trauma can happen there too.
Okay, and then anatomic anomalies, again, similar to the bladder.
Yep. Things like strictures, narrowings, which can be there from birth or happen later. Also, urethrorectal fistulas, which are like abnormal tunnels connecting things that shouldn't be connected, and some conditions related to how sex organs develop, like pseudohermaphrodites.
Gotcha. Something else listed for the urethra was urethral sphincter hypertonicity. Sounds like a muscle control issue.
Exactly. The sphincter is the muscle that holds urine in. Hypertonicity means it's too tight, it's clamping down too hard or spasming.
What causes that?
It can be linked to things like spinal cord problems affecting nerve signals, something called reflex dyssynergia, where the bladder and sphincter muscles just aren't coordinating properly, or even just localized urethral muscle spasms.
And let me guess. Iatrogenic and idiopathic causes pop up for the urethra too?
You guessed it, same pattern. Sometimes medical procedures are involved, and sometimes the reason just remains elusive.
It really seems like those are recurring themes here. Now, the source also specifically pulls out the prostate gland. How does that fit into dysuria and polyuria?
Right, so in individuals who have a prostate, several issues with that gland can actually cause these urinary symptoms indirectly.
Like what kinds of issues?
Things like prostatitis, which is inflammation, or even a prostatic abscess. Neoplasia, again, cancers like adenocarcinoma or transitional cell carcinoma can occur in the prostate. Also, cystic hyperplasia, where the gland enlarges and develops fluid-filled sacs and paraprostatic cysts, which are cysts forming near the prostate.
So a problem in the prostate can sort of press on things or cause inflammation that affects urination downstream.
Exactly. It can definitely have a knock-on effect on the bladder and urethra.
Okay, so we've talked about a ton of specific problems with the bladder, urethra, and prostate. Let's zoom out again. Are there broader things, like risk factors, that make someone more likely to run into these issues?
Yes, and the source groups these risk factors pretty logically. First, there are factors that alter normal host urinary tract defenses and predispose to infection.
Okay, so anything that weakens the body's natural defenses down there. Makes sense.
Second, there are factors predisposing to formation of uroliths, those urinary stones we keep mentioning.
Right, like diet or hydration, maybe.
Could be diet, water intake, underlying metabolic issues that mess with mineral balance, all potential contributors.
And the third category?
That's factors damaging the urothelium or other tissues of the lower urinary tract.
Mm.
The urothelium is that inner lining, like the skin inside the bladder and urethra.
Ah.
So anything causing injury or irritation to that delicate lining can definitely up the risk.
Okay. And wasn't there one more general risk factor mentioned? Something about compression?
Yes, good catch. Mural or extramural diseases that compress the bladder or urethral lumen. Basically, problems around the bladder or urethra, maybe a tumor or inflammation in adjacent tissues that squeeze them from the outside.
Like pinching a hose.
Exactly like pitching a hose. It
Yeah.
interferes with normal function.
Got it. So we have all these potential causes and risk factors, but it seems really crucial to tell dysuria and polyuria apart from other kinds of peeing problems. Yeah.
Absolutely crucial. That's the whole idea behind differential diagnosis, making sure you're dealing with the right problem. For instance, polyuria.
Polyuria. That's different how?
With polyuria, you're also going more often, but critically, you're passing a larger amount of urine each time. Polyuria is frequent, but small amounts.
Okay, so volume is key there.
Definitely. If someone's reporting large volumes frequently, that points away from polyuria and maybe towards issues with how the body handles fluids overall, perhaps kidney issues or diabetes, for example.
Right, different pathway.
Yeah.
What else needs careful differentiation?
Urethral obstruction is a really big one to distinguish. That's a blockage. It often shows up with stranguria, straining really hard to pee, or even anuria, where you can't pee at all.
That sounds serious.
It is. You might feel a very full, distended bladder and see signs of waste products building up because the kidneys can't get the urine out, things like azotemia. It's generally a medical emergency, much more urgent than straightforward dysuria and polyuria.
Okay, definitely good to know the difference there. What about things like incontinence? Leaking.
Right. Urinary incontinence is involuntary leakage.
Hmm.
It might be dribbling, bedwetting, and uresis, or just feeling like the bladder isn't fully empty after going. The key here is the involuntary nature losing control over when urine comes out.
Gotcha. Not the same as feeling the urge constantly, but having control. And lastly, the source mentioned urine spraying or marking.
Yeah, that's usually a behavioral thing, particularly in animals. It's about depositing small amounts of urine, often on vertical surfaces, for communication or marking territory. It's not driven by a physical difficulty or increased frequency due to a medical problem in the same way.
Totally different motivation. Okay, so we've mapped out the potential causes and how to distinguish these symptoms. How do doctors actually figure out which cause is the culprit? What does the diagnostic process look like?
Well, our source suggests that your standard blood test, like a CBC or biochemistry panel, might actually come back perfectly normal quite often,
Right.
especially in simpler cases just involving the lower urinary tract.
Oh, really?
Yeah, but there are situations where blood work can give clues.
Like when?
For example, if there's a severe urethral obstruction, the blood work might show signs that kidney function is suffering, like that azotemia, maybe high phosphate or potassium, changes in acid balance.
Okay.
Or if there's a kidney infection, pyelonephritis, happening alongside the lower tract issue, you might see changes in white blood cell counts or signs the kidneys aren't concentrating urine properly. Acute prostatitis, an infection in the prostate, can also cause high white cell counts. Even just dehydration can show up as elevated protein levels.
So blood tests can give hints, maybe rule things in or out, but they aren't always the main event for diagnosing bladder or urethral issues specifically.
Often that's the case. They provide context, but the real focus is usually on the urine itself. Urinalysis is key.
It makes sense. How do they usually collect the sample for that?
The source highlights that for checking the bladder, getting a sample directly via cystocentesis using a needle to draw urine from the bladder is often preferred because it avoids contamination from the lower tract.
Right, a clean catch.
Exactly. But for looking at urethral problems specifically, a sample collected during normal urination, a voided sample, might be better, or sometimes comparing the two types of samples gives the most information.
Okay.
It's just worth knowing that the cystocentesis procedure itself can sometimes cause a tiny bit of blood to appear in the sample, which the lab needs to account for.
Good point. So what are they looking for in the urine sample?
Okay, so things like finding white blood cells, pyuria, red blood cells, hematuria, or excess protein, proteinuria, those all signal inflammation somewhere in the urinary tract.
But they don't pinpoint the cause.
Exactly. They're like A warning light. They tell you something's wrong, but not what is wrong. Could be infection, could be stones, could be inflammation from something else entirely.
Okay. What about finding actual bugs in there, bacteria or fungi?
Well, if they see bacteria, fungi, or maybe parasite eggs under the microscope, that's a strong indicator that an infection is part of the picture.
But maybe not the whole picture.
Right. It doesn't automatically prove infection is the only issue.
Yeah.
Maybe there's an underlying stone that allowed the infection to take hold.
Hmm.
And you always have to consider potential contamination when the sample was collected.
True. What about finding weird-looking cells? Cancer cells?
Finding neoplastic cells, yeah, that can definitely suggest cancer. But the source adds a note of caution. Sometimes normal urinary tract cells can look atypical or strange just because of severe inflammation, or if the urine itself is extremely concentrated or dilute.
Ah, so it can be tricky to interpret.
It can be. So finding suspicious cells warrants more investigation, but it's not always a slam dunk diagnosis just from the urine sediment alone.
Okay. What about crystals? Crystalluria, you hear about those sometimes.
Crystals are interesting. Their presence, crystalluria, is a bit ambiguous sometimes. You can find them in perfectly normal, healthy individuals. Yep. You can also find them in patients who definitely have stones, and you can find them in patients with lower urinary tract disease who don't have stones. So just seeing crystals doesn't automatically tell you what the main problem is. It has to be interpreted in context with everything else.
Good to know. Not every crystal means a stone. The source also mentions specific findings for cats with that idiopathic condition, FLUTD.
Right, for non-obstructive idiopathic feline lower urinary tract disease. In those cases, they typically see hematuria, blood, proteinuria, protein, and variable amounts of crystalluria. But importantly, significant pyuria, lots of white blood cells, is rare. That helps distinguish it from a standard bacterial UTI.
I see. So urinalysis gives lots of clues, but sounds like you often need more. What about urine cultures?
A quantitative urine culture is really the gold standard for confirming a bacterial UTI. It identifies if bacteria are present in significant numbers and what kind they are, which helps guide antibiotic choice.
And if it's negative?
A negative culture strongly suggests the cause is likely non-infectious, maybe stones, inflammation, neoplasia, or perhaps it's an infection caused by a fussier organism that doesn't grow well in standard lab conditions.
Okay, and besides urine, can they look at cells from other places?
Definitely. Cytology, looking at cells microscopically, can be done on lots of things. Urine sediment, yes, but also fluid expressed from the prostate, any discharge from the urethra or vagina, or even cells collected by flushing the urethra or bladder, or via fine needle aspirates of suspicious areas.
What can cytology tell you?
It's particularly useful for identifying localized inflammation or infection, and sometimes it can confirm cancer if clearly malignant cells are seen. But again, a negative cytology doesn't completely rule out cancer.
Right. So moving beyond lab tests on fluids and cells, what about imaging? Seeing inside?
Imaging plays a huge role. Simple abdominal x-rays, survey radiographs can sometimes show obvious things like certain types of bladder or urethral stones, or maybe abnormalities in the size or shape of the bladder or kidneys.
Okay, basic x-rays. What else?
Contrast studies are really helpful. That's where they introduce a special dye, a contrast agent, into the urinary tract before taking x-rays. Things like contrast cystography or erythrocystography can really highlight the structure of the bladder and urethra, showing up stones that don't appear on plain x-rays, or revealing tumors, strictures, or ruptures.
So the dye makes things visible. What about ultrasound?
Ultrasound is fantastic. It uses sound waves to create images, and it's great for looking at the internal structure of soft tissues, the kidney details, the bladder wall thickness, checking for masses or stones inside the bladder, looking at the prostate. It can sometimes visualize parts of the urethra too.
Sounds very useful. Any other imaging?
There's also excretory urography, another contrast study, which looks more at how the kidneys are functioning and how urine flows down to the bladder. So yeah, a whole toolbox of imaging techniques.
It really sounds like it. And finally, the source mentions some more invasive procedures if the answer still isn't clear.
That's right. If symptoms persist and other tests haven't provided a definitive diagnosis, procedures like erythrocystoscopy might be used. That involves inserting a small camera directly into the urethra and bladder.
To see things directly.
Exactly. It allows the specialist to visually inspect the lining, identify lesions, inflammation, small stones, strictures, or tumors that might have been missed. And they can even take biopsy samples through the scope.
And biopsy, taking a tissue sample, that's kind of the ultimate diagnostic step.
Often, yes. For persistent, undiagnosed lesions, Getting a tissue biopsy for histopathology, detailed examination under a microscope by a pathologist, provides the most definitive information about the nature of the problem, especially for diagnosing cancer or specific types of inflammation.
Wow. Okay, so it's really clear that getting to the bottom of dysuria and polyuria isn't always simple. It can involve quite a detective process, using a combination of history, physical exam, lab tests, imaging, and sometimes these more specialized procedures.
It truly can be. And of course, finding that underlying cause is absolutely critical because the right treatment depends entirely on what's actually causing the problem in the first place.
Okay, let's wrap up this deep dive then. Thinking about everything we've covered on dysuria and polyuria, what's the main takeaway for our listeners?
I think the key message is that these symptoms, painful urination and frequent urination, while seemingly straightforward, can actually point to a really surprisingly wide variety of issues happening in the lower urinary tract.
Yeah, it's not just one thing.
Not at all. We've seen it can range from, common infections and annoying stones, all the way to structural abnormalities, different kinds of growths, and even side effects from medications or other medical interventions.
And it really hammered home that figuring out why someone is experiencing these symptoms often takes careful work by healthcare professionals,
Mhm.
using a whole range of diagnostic tools to pinpoint that specific underlying reason. It's not always obvious.
Exactly. Which kind of leads to a final thought for you, our listener, to ponder. When you consider just how intricate this one system, the urinary system, is, and how many different things can knock it off balance, well, it makes you wonder, doesn't it? What other seemingly simple feelings or signals our bodies give us might actually have similarly complex, maybe even fascinating origins just waiting beneath the surface.
Hmm. That's a great point. It definitely encourages you to think a bit deeper about the hidden complexities of our own biology.